for just $7. Arby's, we have the meats.
Here we are in the month of February. Valentine's Day is this month. It's the time to celebrate love being in the air, but also the time to focus on our hearts. February is Heart Month. This is Dr. John Golding, an interventional cardiologist at Centennial Heart, part of Parkridge Health Center. Good to see you this morning.
Thanks for having me.
Thanks for letting us actually come to you in your home office here.
Yeah.
So this is a month where you're going to hear some kind of buzz phrases. One of them is going to be, know your numbers. I say that on 3+U all the time. I still don't really know what that means. What does it mean, know your numbers?
Well, you know, cardiovascular diseases is one of the most understood things we have in health. There's so many trials and studies that dictate to us how to manage things. And we've learned over time there's certain risk factors that if you know what they are and you know those numbers of things like your cholesterol, blood pressure, blood sugar, and we have certain goals we want to get people to, and those are the numbers we're talking about knowing where you're at, knowing if you're at goal, knowing if they need to be modified.
So blood pressure, for example, let's go with that one. There's kind of a standard window, right, where you should fall?
Yeah, so ideal, you'd like to systolic or top number to be around 120 or less, right?
Okay.
The sweet spot is between 115 and 120.
Okay.
The bottom number, or the diastolic, we would like you around 75. 75 to 80 is ideal.
Okay.
When you're above 130, it's considered like pre-hypertensive, and you really need to pay very close attention to that. See a doctor about what you can do with lifestyle modifications, see if you can get yourself to that ideal spot less than 120.
We've probably all had that experience where you go to the doctor, they take your blood pressure and they'll say, oh, it's high, and then they'll test it again. In a little while, you've calmed down, often the blood pressure drops. So if you take it at home and it's high, do you take it at face value or maybe try it again?
It depends. One-time abnormal reading, we don't do anything about that except for tell the patient to pay more attention.
Okay.
It's dynamic. Your blood pressure never stays at one number. So when you're exercising, it goes up. When you're under stress, it goes up. If you ate a real salty meal, you drank too much alcohol, you had some nicotine, too much caffeine, it goes up. As long as it comes back down and your average is where we want it to be, that's what you need to pay attention to.
Okay, let's talk cholesterol levels. I think those are misunderstood because we have a good one and a bad one. What are those numbers?
So you have the good cholesterol, which is the HDL, and it varies from men to women, what's good and what your goal is, right? So we would like that number to be higher than 40, preferably higher than 50. And the bad is the LDL, which people are probably more familiar with, right? That one varies a little bit based on what's going on with you, what your actual health is. So if you're totally healthy, no problems, we could take that number up to as high as 130. If you have some risk factors, or you have diabetes, or you have vascular disease or kidney disease, we probably want you less than 100.
Okay.
If you've had an event or something equivalent to an event, like a stroke, or you've got uncontrolled diabetes, you've had a heart attack, we really want you less than 70. And there is some, talk in the societies that it's really going to go down to less than 50.
Really?
Yeah.
So if you're a person who struggles with that LDL, that's the bad one, right?
That's right.
If you struggle with that, can you lower that on your own, or are medications generally necessary?
Most people can lower it on their own unless they have a genetic predisposition to high cholesterol.
Okay.
They really have a difficult time doing it with lifestyle modifications. But if you have a bad diet, overweight, not exercising, you correct some of those things, you can lower it.
I think that's one of the encouraging things in having this conversation is because you're telling people what to be watchful for, what you want to address, but the fact that it's also empowering, that you can do something about it is a good thing.
Absolutely, and that's why knowing your numbers is so important. When you look at all this stuff in healthcare, 70% of people with abnormal numbers, it's lifestyle. A lot of it's very correctable. There's some things you just can't control. If you get bad genes, you have bad genes. But the majority of it you can control with lifestyle modification.
That third number, I think you said, is the blood sugar component.
That's right. The hemoglobin A1C, 5.4 or lower is normal. 6.4, but 5.4 to 6.4 is kind of pre-diabetic. And then when you get over like 6.8, you're more in diabetes, and then over 7 is when they start talking about treating you.
That's a big problem around here, isn't it?
Big problem, yeah. This is the diabetic kind of area of the country. Some would say Tennessee's the buckle of the belt, the diabetes belt. But yeah, it's a big problem. Again, it's a lot of lifestyle stuff. It's a lot of lack of exercise, what you're eating, weight gain. There's been big, huge, studies on this, and people have probably seen all these medications that are designed to help with weight loss and reduce cardiovascular risk. And it's coming from all these studies, and we know that controlling blood sugar and weight loss and exercising is huge.
You've been doing this a long time. I know you've watched, I'm sure, as the statistics improve. My dad died of a heart attack in 1981, and he was about to have what was then an experimental new procedure called bypass surgery.
Oh, yeah.
And look at how that's just, kind of run of the course now. Yeah. We've come a long way. Does it excite you to think that there are even new things around the corner that could improve people's outcome?
Oh, for sure. Everything has gotten better. It's such a big disease burden, and a lot of research and technology goes to improving it and treating patients with it. And bypass surgery, which used to be the only way to revascularize people, has obviously transitioned a lot into what we call percutaneous, so stenting and ballooning and things of that nature. And it's really, you got to really have a lot of stuff going on to need bypass surgery now. Most stuff can be fixed with balloons and stents. And even that's transitioned from going through the leg to doing most of this stuff through the arm. We got heart valves now that we're doing through legs. We've got valves we're repairing with clips through legs. So it's, the technology keeps getting better and better and better. The equipment gets better and better and better, and the durability of what we're using gets better and better and better.
So give people kind of something they can take away from this conversation. While you're saying, I love you to everybody else in your life, love yourself by knowing these numbers. Go get a blood pressure monitor, go get something to test your blood sugar levels. What do you encourage people to do?
Yeah, you should have a blood pressure cuff for sure. Testing your blood sugar at home, I don't know if you have to go that far. You can. I don't know if you really need to unless your doctor has told you you're pre-diabetic or they're concerned that you're kind of getting closer to that and they've trended your A1C over time and saw it's going up. Cholesterol, obviously, you really can't check at home. But the big thing is, establish with your primary. Make sure they're getting these numbers checked for you. If you have any issues with the numbers, figure out how to modify what you can to correct what you can. And if you can't, and they can't get it fixed for you, then they need to send you over to us so we can get things where they need to be.
Dr. John Golding, you'll find him at Centennial Heart. Again, he is an interventional cardiovascular doctor, cardiologist. That's the word I'm looking for. Here are the numbers, the phone number for Parkridge and Centennial Heart. You can find out your own. Great to talk to you this morning.
Thank you.
A new year brings new possibilities, so why not try